Prenatal care and fetal development. Welcome to HESI EXIT Maternity Nursing, Prenatal Care and Fetal Development. This comprehensive guide will help you understand the essential aspects of prenatal care and how babies develop during pregnancy. Understanding prenatal care. Prenatal care is the medical supervision given to pregnant women to promote both maternal and fetal health throughout pregnancy. The goals of prenatal care include early detection and prevention of pregnancy complications, monitoring fetal growth and development at every stage, providing maternal education on proper pregnancy care, supporting healthy lifestyle choices throughout pregnancy. Key healthcare providers: obstetricians who specialize in pregnancy and childbirth, certified nurse midwives who provide personalized care, nurse practitioners and registered nurses who support maternal health. Why prenatal care matters. Prenatal care is essential for ensuring healthy pregnancy outcomes. Key benefits: reduces the risk of serious pregnancy complications such as preeclampsia, gestational diabetes, and preterm labor. Ensures fetal well-being through regular assessments and monitoring. Promotes healthy maternal lifestyle choices including proper nutrition, safe exercise, and mental health support. Helps prepare mothers for labor, delivery, and postpartum recovery. Components of prenatal care. Effective prenatal care includes several important components. Comprehensive health assessments. Medical and obstetric history review to identify risk factors. Physical examinations including weight, blood pressure, fundal height, and fetal heart rate monitoring. Laboratory tests such as complete blood count, blood type and Rh factor, urinalysis, and STI screening. Maternal education. Nutrition guidance and lifestyle modifications. Information about prenatal vitamins and supplements. Teaching about signs of complications and fetal kick counts. Routine monitoring and screening. Ultrasounds to assess fetal development. Glucose testing to screen for gestational diabetes. Continuous fetal heart rate monitoring. Prenatal visit schedule. Regular prenatal visits follow a specific schedule throughout pregnancy. First trimester, 0 to 12 weeks. Initial visit followed by appointments every 4 weeks. Establishing baseline health and confirming pregnancy. Second trimester, 13 to 27 weeks. Appointments continue every 4 weeks. Monitoring fetal growth and maternal health. Third trimester, 28 to 40 weeks. Appointments every 2 to 3 weeks until 36 weeks. Weekly appointments from 36 weeks until birth. Increased monitoring as delivery approaches. First prenatal visit, key assessments. The first prenatal visit is comprehensive and establishes the foundation for pregnancy care. Medical and obstetric history. Review of past pregnancies and outcomes. Discussion of chronic illnesses and medications. Family health history assessment. Physical examination. Weight and blood pressure measurements. Complete physical and pelvic examination. Baseline vital signs. Laboratory tests. Complete blood count to check for anemia. Blood type and Rh factor determination. Rubella immunity status. STI screening including HIV, syphilis, gonorrhea, and chlamydia. Urinalysis to check for protein, glucose, ketones, and infection. Patient education. Importance of folic acid in preventing neural tube defects. Safe exercise recommendations. Nutrition guidelines for pregnancy. Nutrition and weight gain in pregnancy. Proper nutrition is crucial for maternal and fetal health throughout pregnancy. Essential nutrients. Folic acid, 400 to 800 mg/day, prevents neural tube defects. Iron, 27 mg per day, supports increased blood volume. Calcium, 1000 mg per day, supports fetal bone development. Protein, 75 to 100 g/day, is needed for fetal growth. Recommended weight gain. Underweight women, 28 to 40 pounds. Normal weight women, 25 to 35 pounds. Overweight women, 15 to 25 pounds. Obese women, 11 to 20 pounds. Foods to avoid. raw seafood and unpasteurized dairy products, high mercury fish, alcohol and excessive caffeine. Fetal development overview. Understanding fetal development helps monitor pregnancy progress. Stages of development. Pre-embryonic stage, 0 to 2 weeks, involves fertilization and implantation. Embryonic stage, 3 to 8 weeks, includes organogenesis and neural tube formation. Fetal stage, 9 weeks birth, focuses on growth and maturation of organs. Key milestones. Heartbeat detectable at 5 to 6 weeks. First movements felt at 16 to 20 weeks. Lung maturity achieved at 36 weeks. First trimester fetal development. The first trimester involves rapid development of all major body systems. Weeks 4 to 5. The heart begins to beat. Basic structures start forming. Week 8. All major organs begin to form. Limb buds appear and start developing. The embryo starts taking human shape. Week 12. Fetal heartbeat becomes detectable by Doppler. Intestines move into the abdomen. Bones begin to harden. Second trimester fetal development. The second trimester is marked by significant growth and development. Week 16. Quickening occurs as the mother feels first fetal movements. Facial features become more defined. Week 20. Vernix caseosa and lanugo develop to protect the skin. Gender can be identified via ultrasound. The fetus begins hearing sounds. Week 24. Fetal viability becomes possible with medical support. Lungs start producing surfactant. Brain development accelerates. Third trimester fetal development. The third trimester focuses on final maturation and preparation for birth. Week 30. Rapid brain development continues. Fat stores increase for temperature regulation. Week 34. Sucking and swallowing reflexes develop. The fetus practices breathing movements. Week 36. Lungs reach maturity. The fetus typically moves into head-down position. Preparation for birth is complete. Week 40. Full-term birth occurs. Average weight is 6 to 8 pounds. All systems are ready for extrauterine life. Common pregnancy discomforts. Understanding normal pregnancy discomforts helps women know what to expect. First trimester. Nausea and vomiting, especially in the morning. Fatigue and increased need for sleep. Breast tenderness and sensitivity. Frequent urination. Second trimester. Back pain from the growing uterus. Round ligament pain with movement. Leg cramps, especially at night. Increased energy levels. Third trimester. Shortness of breath as the uterus pushes on the diaphragm. Swelling in feet and ankles. Braxton Hicks contractions. Difficulty sleeping. Warning signs in pregnancy. Certain symptoms require immediate medical attention. Serious warning signs. Severe headaches and blurred vision may indicate preeclampsia. Decreased fetal movement could signal fetal distress. Persistent vomiting and dehydration may indicate hyperemesis gravidarum. Vaginal bleeding or severe abdominal pain requires immediate evaluation. Sudden swelling of face and hands. Fever above 101 degrees Fahrenheit. High-risk pregnancy factors. Some factors increase the risk of pregnancy complications. Maternal age. Women under 18 or over 35 years have increased risks. Pre-existing conditions. Diabetes mellitus. Hypertension. Autoimmune disorders. Pregnancy-related complications. Multiple gestation, twins, triplets. Placenta previa or abnormal placental placement. Lifestyle factors. Smoking and tobacco use. Alcohol consumption. Drug use. Prenatal diagnostic tests. Various tests monitor maternal and fetal health throughout pregnancy. Ultrasound. Assesses fetal growth and development. Anatomy skin checks for abnormalities. Amniocentesis. Genetic testing for chromosomal abnormalities. Lung maturity assessment in late pregnancy. Non-stress test, NST. Monitors fetal heart rate patterns. Assesses fetal well-being. Glucose tolerance test. Screens for gestational diabetes. Performed between 24 to 28 weeks. Importance of fetal kick counts. Monitoring fetal movement helps assess fetal well-being. Starting at 28 weeks. Mothers should track fetal movement daily. Best done at the same time each day. Normal pattern. 10 movements within 2 hours is reassuring. Movement patterns vary by fetus. Reduced movement may indicate fetal distress. Requires immediate medical evaluation. Could signal placental insufficiency. Preparing for labor and delivery. Advanced preparation helps ensure a positive birth experience. Birth plan discussion. Preferred birth setting and environment. Pain management options and preferences. Support person choices. Signs of labor. Lightening as the baby drops into the pelvis. Regular contractions increasing in intensity. Membrane rupture or water breaking. Bloody show. Hospital admission procedures. Cervical examination to assess dilation. Continuous fetal monitoring. For access if needed. Patient education and support. Emotional and educational support improves pregnancy outcomes. Emotional support. Coping strategies for pregnancy stress. Prenatal classes for education and preparation. Mental health screening and resources. Support systems. Partner involvement in prenatal care. Family support networks. Professional support like doulas. Postpartum planning. Breastfeeding education and preparation. Newborn care basics. Maternal recovery expectations. Let's review the key concepts. Essential takeaways. Prenatal care is essential for maternal and fetal health throughout pregnancy. Fetal development occurs in predictable stages from conception through birth. Warning signs should be monitored carefully for early intervention. Education and support improve pregnancy outcomes significantly. Regular prenatal visits follow a specific schedule to ensure optimal care. Thank you for watching Prenatal Care and Fetal Development. You now have a solid foundation in understanding prenatal care and fetal development. Continue to learn about the labor and delivery process. Remember, knowledge is power in nursing practice.